run in families. So you can see bunions from about the age of 2. So if you have any grandchildren with bunions, if you have bunions, and your daughters and sons have bunions, the children should be treated early. You can treat them successfully before the age of 5. It's very difficult after that. They do need to be treated right at the beginning. Now, if you don't have bunions, you probably think bunions are a bit of a joke, because you don't really understand what they are. What they do though is they stiffen the big toe joint, which is one of the most important joints. Hi there. It's alright. One of the most important joints in the foot. So if your big toe joint doesn't work properly, nothing else is going to work properly, again including the knees and the hips. With every step, you need to move your body weight over your big toe joint, so it has to be fully mobile. There was a study done a couple of years ago by some Swiss doctors that showed there's a pumping mechanism within the big toe joint, a circulatory pump. So if your big toe joint isn't working properly, you don't actually pump the venous blood back up to your heart properly. So it's not just the leg that pumps the blood back, it's the big toe joint. So vitally important really. And you need 55 degrees movement upward at the big toe joint in order for it to work properly. The minute you lose that range of motion, you change your way of walking, you start to twist to push forward, and then your knee is unsupported. So it tends to cause a knee problem and back pain and hip pain. So feet are very finely balanced, really, I suppose is what I'm saying here. Everything has to be in the right position. The joints have to work properly. Now, if your bunions are flexible, even as you get older, you don't have to have surgery. You only need surgery if they're rigid and very painful. Bunion surgery isn't very successful in flexible bunions. There's a lot that can be done by a podiatrist, really, to straighten out the bunion.
Such as what?
Wearing orthoses, wearing toe dividers between the big toe and the second toe. But toe dividers only work if you've got orthoses in. Otherwise, you just push the other toes across. You can wear a night splint. There's a splint, I didn't bring any with me today, but there's a splint you can wear in bed that straightens the bunion as well. So you need to do all of those things. A podiatrist can show you how to put strapping on the joint to pull it straight and prevent any pressure and any friction. So, there's a lot you can do. Yeah. Surgery doesn't always work in bunions. I mean, surgery is great on hips and knees, nothing to worry about. It's not very good at foot level. So you have to be very careful about foot surgery. The hereditary factor that causes the bunion is this bone here, first metatarsal being too short. Any type of bunion surgery will shorten that further. So you then have a less functional foot. So the shorter this bone becomes, the less effectively it will function. So you really just have to have surgery if you're in great pain and the joint's completely rigid. But don't go for it otherwise, it's not that great really. In terms of foot surgery, toe straightening is fine. That's a very simple operation. So if you have a hammer toe that sticks up, it's worth having a tendon lengthening and the joint taken out. That's very simple surgery, it works very well. Any reconstructive surgery in feet is quite complicated, so again, best to avoid. You're better off with orthoses really. And ankle surgery again is quite tricky. The ankle is just a hinge joint. That's all it's designed to do. So the surgery that's done on ankles tends to fix it, so it's stuck in a certain position, and then you can't really walk properly. So again, it's best to avoid it. But the thing really is to treat things before they get to that stage. If you've got an in-rolling foot, you're getting a swollen ankle, you need to get orthoses, you need to get the foot back into position, keep everything moving properly. So those are the scary things, I suppose, and there are a few more to come a bit further along. But I thought, what are the common problems of aging feet? The first is dry skin. As you get older, your skin gets quite dry. So you do need to use a moisturising cream on the feet every day. This goes for men as well as women. If you can moisturise your feet, you keep the skin nice and supple. It will be a lot stronger. It will be a lot more resistant to fungal infections.
What do you recommend? What particular moisturiser?
There's all sorts of things. Vitamin E cream is really good. Vitamin E cream, really good on the feet. The German creams, the Gerhold creams are really good. The Acryline, the French ones, are good as well. There are a lot of good foot creams. CCS cream, actually, if any of you know that. CCS is not expensive and it's a really good foot cream. Hello. So that's a good one to use. And you need to use it once a day, really, in order for it to be effective. One of the other things that's good about putting the moisturiser on your feet is you're looking at your feet, you're checking them. Because you can lose a bit of sensation in the feet as you get older. So you can't always rely on feeling what's happening. It's worth actually looking at them. And if you find it hard to look at them, look in the mirror so you can see what's going on. Look for any cracks between the toes. Look for anything weird on the feet, just in case you're not feeling what's changing.
What about if you suffer from arthritis?
From arthritis?
Yes, there's another thing that you lose your balance.
Yes.
When you move.
I'm going to come to that.
All right, thank you.
It's on my list.
Sorry about that.
Because, so I'll stop with the simple, superficial things.
Sometimes you have to use your hip a lot.
You do.
You know, to walk.
Yeah.
You know what I mean? Because you lose balance.
You do.
And
I'm
with
going to
arthritis.
talk about balance. Now the nails get thicker as well as you get older. In most people. Some people get thinner nails actually, but most people end up with quite thick nails. And the only way to deal with that is to file them. And file them in the direction in which the nail grows, rather than across. The nail grows in little grooves on your nail bed, and it actually is embedded in those grooves as it grows forward. So you need to file along the full length of the nail to keep it thin, and then it's easier to cut them. Now, poor circulation is the other factor, obviously. It always gets worse as you get older. It can be difficult if it's an arterial problem. There's not a lot you can do, really. But a lot of the time, it's venous, actually, so exercise helps. So it doesn't mean going for a run, but basic, simple exercises, ankle rotations, to get the heart working in the leg, pumping the blood back up into the heart. If your feet tend to swell during the day or at the end of the day, elevate them, put them up for 10 minutes, drain the blood back to your heart. Because of gravity, the blood drains down into the feet, so if you stick the feet up, you can drain it back to the heart again. Stretch your muscles, that will help too. Now you can do very simple stretches. I know some of you go to exercise classes, people have been telling me, but if you find it hard to stretch, you can stretch sitting down. If you just, as you're sitting in your chairs, put your feet out in front of you and push your heels away from you, exactly, you get quite a good calf stretch. And if you straighten the legs, it starts moving up into a hamstring stretch as well. So you can do these very simple stretches and they're very effective. So you go into the position, hold it for 30 seconds, relax and then repeat it, and do that a few times whenever you're sitting. So ankle rotations, stretching the calf muscles, really important. Holding on to something and standing up on tiptoe is a good one too. Keeps all those toe joints mobile, and it gets the pump working in your legs to pump the circulation, the venous return back up to your heart again. The other thing that's very important, not just for circulation, but neurologically, is a foot roller. Now these little things, these are the simple ones. They're called Teddy rollers. You get them in Boots. They're only £5. They send different messages from the soles of your feet back to your brain. So keep your foot-to-brain connection working. Because one thing that again happens with age is people tend to get a lack of sensation to the feet. You don't notice that happening because it happens very slowly. We're in shoes all the time. We're not walking barefooted on uneven ground. So we do need to use foot rollers just to get those messages going back from different bits of the foot to the brain. But you find this is very important, particularly as you get much older, and really important to have used a pedie roller or any sort of foot roller, whatever you have. I think these are the cheapest ones you can get. I don't work with a pedie roller, by the way. But they're just good little product. Oh yeah, and the other thing is the loss of sensation, which of course comes with diabetes, but it comes with lots of other things too, is the thing about visually checking your feet. You can't rely on knowing you've got a problem if you can't really feel them properly. So, use a mirror, sit with the soles of your feet facing a mirror, look at them if you can't turn your foot around. Check between your toes for any cracks. Any podiatrist will tell you, and I've seen this many times, patient will come into a clinic with lack of sensation with the drawing pin on the sole of their foot, and they won't know it's there. Seriously, time and time again. So, most of you won't go on to develop that lack of sensation, but even a little loss of sensation makes a difference, and makes a difference to your balance, which is the other big factor. So coming on to poor balance, which is the other factor number 4, with aging feet. Yes, of course you get it with arthritis. You'll get it also with iliac problems. You'll get it with the peripheral neuropathy, the lack of sensation. You can't feel where your feet are, your balance will go. So if you look at all, there's been a lot of research into falls and the reason people fall as they get older, and it's not all to do with the eyes. A lot of it is to do with unstable shoes. So stability of the shoe is a key factor. Trainers are great. When you look at a shoe, look at it from behind. What you should see is that the heel of the shoe sticks out a little bit beyond the upper, and that gives you full stability. If you look from behind your shoe and the heel comes in and it's narrower than the upper, you're going to fall over. You need something that's at least as wide as the upper of the shoe and a little bit wider if possible. So trainers tend to be wider in the heel. Echoes can be, but there are different fashions in shoemaking. Yeah, it is something to be aware of, because there was a fashion for the last couple of years of undercuts in shoes. It's thrown a lot of people off balance. So if you find your balance is getting worse, you need orthoses. You need orthoses to stabilise you, whether they're off the shelf or proper ones. You need the proper shoes. You might need toe props. Now, podiatrists can make moulded silicone toe props, which are things we make for the patient. Go under the toes. They hold your toes nice and straight, which increases your weight-bearing surface, and that gives you greater stability. A lot of people, as they become unstable, claw their toes to balance. Now, if you claw your toes, you're shortening the foot, you're making it less stable. The longer your toes are, the flatter they are, the more stable you'll be. So toe props are good. You can buy off-the-shelf toe props as well. They make little suede ones. Just be careful with those if you've got poor circulation, because they've got an elastic strap going over a toe, which isn't so good. So moulded silicone ones are safer, really.